presentation over the pathogenesis of cat scratch disease. This is Callie. She's my kitten. She is a year and 3 months old, so a little bit over being classified as a kitten, but she's still really tiny, so I still call her a kitten. I got her last year when she was only 3 months old, and if I had known then what I know now about this disease, or if I even knew about it, I would have probably waited to get a cat that was at least a year old, or maybe just not let her go outside on the balcony. She ended up getting fleas, and I have learned that that was probably one of the worst things that I could have gotten myself into. Worst case scenario, in which this didn't happen, but she could have contracted cat scratch disease and passed it on to me. I would have been down sick for some days, weeks, some people months, and she would have been just fine. I will be giving some background as well as the pathogenesis as far as physiological effects, molecular mechanisms, and cellular mechanisms. So here's some background information. Cat scratch disease is a bacterial infection caused by the aerobic gram-negative bacterium Bartonella henselae. It is found in the saliva of a cat after it has been infected by a flea. That means that this disease is transmitted via direct contact of a vector. It is a very common disease in the United States, and actually more common than Lyme disease. Down here in the South, I've heard about Lyme disease a lot, but I've never heard of cat scratch disease, not that I can think of at the moment. So that's really surprising to me that it's so common, especially down here. It's mostly transmitted from kittens, which goes back to my intro. If you plan on getting a cat, wait till it's at least a year old. Or, of course, don't let it outside if it's not. As well as feral and stray cats. I know they're really intriguing to go up to, try to play with them and all, but you never know what these cats out there have. So it's important, try not to interact with them, but if you do, you can't help yourself, wash your hands immediately after, and even any part of your body that the cat may have touched. Especially if it maybe did a little scratch or even a little nibble. All of that could lead to you contracting cat scratch disease. Most cases of this disease were found in the southeast and in children under 15 years of age. So as I get into the pathogenesis of it, I would like to show a diagram of how it gets to cat as well as human. So of course you have the beginning of the life cycle of a flea. Eggs are shed, they hatch into larvae, pupae, boom, there's your adult. The way that this disease gets to cats is if there's any abrasions or scratches, any wounds on the cat, and any of the fleas that the cat may have, if any of their feces is infected with Bartonella henselae, then the cat will then contract it. As far as passing it on to humans, cat scratch disease. So any scratches, anything that punctures the skin, that could lead to the cat passing that disease onto the human, as well as any of the cat's saliva getting into possible wounds that the human may have. So it's really important to make sure you wash up if that ever happens to you. It is also believed that humans can get cat scratch disease directly from cat fleas, but there's not enough evidence to support this claim, so it's not really thought about anymore. On to the physiological effects. The signs and symptoms align with those of the flu, so for example, a fever would possibly be, the person would possibly have a fever, it wouldn't be anything really bad, maybe low to mild fever. And of course, swelling of lymph nodes. So here in this picture on the left side, you see that there is punctures in the hand of the person. This is where they contracted the disease. And the lymph nodes that are closest to the site, they're swollen and red. So that goes into the lymphadenopathy. Also, of course, the wound will scab over and pustules could form. And what a pustule is a bump up under the skin that contains any pus. Tissue damage may also occur at the site. This isn't something that you will know right off the bat after getting bitten or scratched or anything that you have, but within the time frame of 3 to 10 days, these signs and symptoms would show up and you'll know, like, hey, something's wrong with me. There's not really anything to rush to get to the doctor about. Obviously get checked out if something's wrong with you, but it is self-limited, so there's not much that they can do. They can help you as far as treating the signs and symptoms, but there is no direct treatment for cat scratch disease since it is self-limited. It's all up to your body to kick it out, and for some people this could take weeks, or other people it could take months. It all depends on how strong your immune system is. On to the molecular mechanisms. The bacterium Bartonella henselae, it binds to endothelial cells, and then it uses Vir-B, Vir-D4 secretion systems in order to inject effector proteins into the host cells. And what this does is alter cell signaling pathways, which prevents apoptosis, which is also known as cell death. It will also encourage VEGF production, which then encourages angiogenesis, which is abnormal blood vessel growth. Next, on a cellular level, as you see, the bacteria is on the inside of the red blood cell, and this pore right here is the connection to the outside cell. That's what the Bartonella henselae came through in order to get inside of the cell. It invades endothelial cells as well as macrophages and survives inside of them. It helps them to basically bypass the immune system. So that Th1 immune response that is going on, because the bacterium is surviving inside of the cells, it won't be exposed to it. And what this will cause is granuloma formation, which goes back to those lymph nodes in the lymphadenopathy. I hope I said that right. Hang on. Yeah, lymphadenopathy. Yeah, I was close. Sorry. In the lymphadenopathy. And yeah, they'll be swollen and painful and red. So in conclusion, cat scratch disease is caused by the bacteria Bartonella henselae. And on back to the molecular and cellular mechanisms that are used. Molecular, type 4 Vir-B and Vir-D4 secretion systems are used to inject these effector proteins to promote survival on the inside of the cell, as well as the stimulation of angiogenesis, the abnormal blood vessel growth. And the cellular mechanisms, the bacterium invades the endothelial cells and macrophages, which triggers that Th1 response, leading to the inflammation of the lymph nodes. While it is a self-limited disease, particularly in healthy people, for people that are immunocompromised, it can be really severe. So If you just so happen to be one of those kinds of patients, then it will be very, very important for you to get checked out as soon as you notice any of these signs after getting scratched by a cat, or really any interaction with a cat. It's never bad to be too safe. Thank you.